It's July 16th and I'm at my house. Okay. Have you ever rolled your ankle and it's been an excruciating pain for a few days? Well, you're not the only one. 25,000 people sprain their ankle every day in the United States. More than 1 million people visit emergency rooms each year because of ankle injuries. Most of them are ankle sprains or fractures. These include ligaments and bones in the ankle. Sprains are the most common injury in sports today, other than concussions. The anterior talofibular ligament is the most commonly injured ligament in the ankle. This ligament is, all ligaments are found around your body and they prevent extra movement in the joints and they help stabilize the joint around your body. When sprained, there are 3 different grades that determine the healing process and how much of the ligament is torn. So today I will be talking to you all about ankle sprains, how they happen, how they can be prevented, and how they can be rehabilitated. But first I'm going to give you some background about ankles or ligaments in the ankle. And so what is a ligament or what is a sprain? It's a tear or stretching of the ligament, and people commonly get sprains confused with strains and ligaments confused with tendons. So tendons are, they come from muscle and attach to bone, and they're part of a muscle. So if that was to be torn, then that would be called a strain. And a ligament attaches from bone to bone, and if that was to be torn, it'd be called a sprain. So how is a ligament torn? It's torn and caused by a force that it's not supposed to happen on the ankle, and the force is too strong to prevent. Sorry, hold on. Okay, so it is caused by a force they are not meant to prevent, and the force is too strong, so the ligament will just tear or completely snap in half. So the Randolph Hospital of Human Motion Institute says that ligaments help stabilize joints by preventing excessive amount of motion. And you can easily sprain ligaments by just walking on the sidewalk. You can be walking on the edge and your ankle just gives out, and it's because it's weak, and then you can just totally sprain your ankle that way. And it's most commonly sprained on the lateral side, which is the outside of your ankle. And it's caused by the foot inverting, which means your foot is going to go in towards your other foot, and it's going to the ground is going to touch the outside of your foot. And this is called an inversion ankle sprain. The common symptoms that you will see with an ankle sprain are swelling, bruising because you tore the ligament and it's going to bleed, and then pain because you tore a ligament, and then for 2 of the grades, you'll not be able to weight bear because the injury is so bad. You have multiple ligaments in your ankle, but the most common is the anterior talofibular ligament. And it's attached on the anterior part of your ankle, which is the front part of your ankle, and it attaches on the talus and the fibula, which it kind of says that in the name. Most people think that women will tear their ligaments more than men, and this is because of hormones and everything. But there's no gender that is at a higher risk in tearing a ligament in your ankle. Women do have a higher risk of tearing their ACL because of hormones. To prevent someone from having an ankle or yourself from having an ankle sprain, you have multiple ways of doing this. You can go to therapy and do strengthening exercises, or you can just wear an ankle brace. So going back to who gets ankle sprains more often, the Journal of Bone and Joint Surgery states that males compared to females did not demonstrate any overall increased incident rate ratio for ankle sprains. So that means that there isn't really anyone that would get an ankle sprain more. For prevention, the American Academy of Family Physicians claim that you can prevent further sprains and setbacks by wearing a semi-rigid ankle brace while exercising for 1 to 2 months, and then you can also have special wraps, or you can tape your ankle to help prevent ankle sprains, and you can use adhesive tape just to help that from occurring. The AAFP also states that a program of ankle exercises will also help prevent re-injury, and this will help with the muscle strengthening so that you won't go on that sidewalk and sprain your ankle. The muscles around that need to be strong so that this won't happen. You can do exercises even if you didn't sprain your ankle. You want your ankle to be strong and to prevent this from happening. And if you have sprained your ankle in the past and didn't do rehabilitation, then there's a possibility that you might have complications in the future with chronic pain or instability of your ankle. And chronic pain is pain lasting more than 3 weeks. The AAFP also states that because of a previous ankle sprain, there's a greater risk factor for an acute ankle sprain because of the muscles being weak. And then recovering patients should be counseled on preventing strategies of the ankle with braces and supports by taping and a focused neuromuscular training, which will help with the strengthening of your muscles. And you need to have a sport-specific training program or warm-up that can protect against injury. All right, so depending on the grade of your injury, there's 3 different grades. 1 is 0 to 50% torn, and 2 is 50 to 99% torn. With the grade 1, you'll have some pain, and then with grade 2, you'll have pain and laxity, which is movement that normally is not there. And then grade 3, you'll be 100% torn. You'll have pain at the beginning, but then soon after that, it will go away. And you'll have increased laxity with that as well. All right. So if you have a grade 3 sprain, you're going to have to get surgery most likely because it's completely torn. And there are 2 different types of surgeries for that. There's arthroscopy, which is a camera and tools that go in and take out bone or ligaments that are messing up with the joint. And then there's reconstruction, which they take that whole ligament that has been torn out of your ankle, and they either go back in and stitch it back up, or they take part of another tendon or another ligament or a muscle and reconstruct the ligament by that. And the AAOS states that surgical treatment for an ankle sprain are rare. It's reserved for injuries that fail to respond to treatment, like ankle rehabilitation or strengthening. And it's used for patients who experience persistent instability after rehab. So there are multiple ligaments in your body, and there's multiple ligaments in your ankle, but the most common one is the anterior talofibular ligament. you need to prevent this. People need to prevent it by strengthening, and just getting those muscles strengthened will prevent an ankle injury. And the different grades will also help the doctors and physicians help determine how long the healing process will be, and what kind of steps you need to take to heal your injury. So in conclusion, the most commonly injured ligament is the anterior talofibular ligament, as I said previous before. And this helps support the joint, and it helps prevent the excessive movement of the joint. If torn, there could be like there's different stages or different grades that will be affected, and it will help determine how you will recover, and how you need to take the next step to heal your ankle. And thank you for coming.